So thank you all for joining us today for our first Concussion Masterclass. This is a new webinar series that we're building out with the Peterborough Athletics Concussion Awareness, and the goal is to do a clinical deep dive for today into the Parents Playbook for concussions. This webinar series will bring more clinical insights and more insights directly to coaches and parents and the people who are making the decisions for Peterborough's youth on the topic of concussion. So today, as I just mentioned, we have the Parents Playbook. So we thought this was a great first webinar to start with because it actually is going to dive into one of the most critical topics is how a parent navigates concussion recovery for their child. As a person who was a child when I was going through a lot of my concussions, I know how important that is and how impactful my parents were in my recovery, and being able to navigate this was not an easy process for them. So it's very personal to me as well. But in this, we'll talk through the whole gambit of how to deal with all the different factors involved, like going to see a doctor, also the return to school, return to sport, and of course, this will be host or our expert today will be Dr. Steph Dalliare, who's a family doctor with the Peterborough Family Health Team. He's also the medical doctor for the Peterborough Petes and a physician educator with Concussion Echo. Before we dive into more of the actual content here, did want to actually just do a brief shout out to PACA and explain a little bit about the work that we do, just super briefly. So we work in four main areas around the community. So first and foremost, we do youth concussion education, and we do this in schools. We work with almost all of the high schools on an annual basis. I think almost all of them, except for maybe one. And we go in there, we do education programming with their students, typically grade 11s and 12s, and we work with them to educate them on concussions, but also sport values and other programs like that. And we do the same type of programming with sports organizations. We partner with many of them across the Peterborough County. On top of that, we've built many community resources. So in particular, the local concussion docu-series called Recognize, Remove, Manage, and Prevent. We created that back in 2023, and it's been a long-standing education piece that we're really proud of. On top of that, we do have education modules on our website that's available for anybody to use at any given time, and it gives you a certificate of completion at the end of it. Each module takes about 20 minutes and a fantastic resource for anybody looking to learn more about concussions. And new this year, we're building on some of the work that we've done. We have a podcast that we launched last month called the Sideline Series, and now we're doing these webinar series called the Concussion Masterclass, which we'll be doing 5 of them throughout this next year and a bit. On top of that, we have done the Peterborough Concussion Summit, which happened last year, and we also are doing ongoing awareness through our monthly newsletter and social media and community event participation. So just so we are aware, we do have more webinars coming. So our next 2 scheduled webinars are the Concussion and Mental Health webinar, which will be October 21st in partnership with the Canadian Mental Health Association, Haliburton, Kawartha Pine Ridge. So we're going to work with them. They'll have a speaker that'll talk about the mental health aspects, and we'll have one that talks more about the concussion aspects. And after that, we have a returning to school after concussion with a member of our panel, Dr. Joanna Hamilton, which will be on November 26th. All right, and so now just an overview for today. I don't anticipate we'll spend more than 45 to 60 minutes here today as we go through this, but you never know. We'll try and keep it within that range. The topics that we'll go through today will be when and where to seek care, diagnosis and first visit and what that's like, what that process can be like, questions to ask, and so forth. A general recovery plan, and maybe into some of the specifics as well. Follow-up and care, and what that can look like and when it's needed. And then, of course, return to school and sport, and returning to play and the different considerations. Afterwards, after we go through all the topics, we're going to have a question and answer period where you'll get to ask Dr. Steph Dalliare any questions that you'd like. We may cap that depending on our timing, but we'll try and get to as many questions as possible. And with that, I'd like to formally introduce Dr. Steph Dalliare to the webinar. Thanks, Steph, for joining us. The first aspect of what happens is, so we'll start at the very beginning, right? Say a kid gets injured on the field of play. Let's say it's in sport. What does that process look like? When do you think that the signs are showing up to when they should seek care, and where should they maybe go? What should be their first step depending on what's happening?
If we're gonna stick to if we're gearing towards kids, which I think this is what it's
Yeah,
more and more parents, because obviously this is not just an injury for sport, athletic youth, but, for today, I think that's a reasonable place to start.
yeah,
So a lot of parents will have, they hear of maybe their child that, had an injury of some sort. It can be even just at recess. Often we're getting, "Hey, I was hit by a Frisbee, and just playing at recess or something." And schools are becoming much, do with education and with Rowan's law, there's a lot more awareness, and schools are putting into practice certain policies, and are much more conservative with regards to, hey, you get that phone call, your child got a knock, maybe it's something, maybe it's not. And then you have the ones that are an obvious injury, playing rugby, they took a hit, they're not feeling well, they've been sat out, and then what's next? The process is still going to be the same because you need to be diagnosed and assessed, right? And anytime we hear of an injury, I find it is challenging, right? For even as a parent of young athletic kids, and I've also gone through my fair share of concussions, that wishy-washy one, the wayward frisbee, or I was playing, I got tripped up while playing tag, and the kids, especially the young kids, are like, "I'm not sure what I'm feeling." And that you hear that all the time, right? Like, I don't and that's where we have to go, "Okay, let's dive into this a little bit deeper." So it does take an assessment, and I do encourage people to go seek some type of an evaluation. In our society, it's hard. In our medical system here, it is challenging to get in right away for an injury. So, again, as a background, previous to practicing family medicine, I was a full-time emerge physician, both in Kingston General Hospital and at PRHC. I was also a sports physician at Queens for a little bit. And we don't wanna overclog our emerge system. I get that, and no one wants to wait for a long period of time, if we don't need to, and, uh, walk-in clinics are not readily available, and family physicians to get in to see your family physician is sometimes quite challenging. Sometimes they're booking, 3 weeks out, and all of a sudden you're like, "Wait a minute, but I need to know what I'm gonna do today and tomorrow." And if that's the case, unfortunately, you will need to rely on probably going to the emerge. And though we all recognize that's probably not the best place to be assessed, if that's what we have, unfortunately, we have to do that. And most of the emerge docs know this, right? They know what's happening with the family medicine and the walk-in clinics and the day clinics and the after-hour clinics. So it's tough. But they will do an assessment. Um, where should I go from there, do you think, Ryan?
yeah. So I think really I think you went through it right. So it's not, if your family doctor is unavailable, that's probably your first check-in, right? If
Yeah.
you think
Yep.
something's up, family doctor. If the family doctor isn't available, see the walk-in clinics. If that's not, or there's after hours clinics too, right?
Yep.
If that's not available, then kind of the last remaining option would be emerge.
Yes. Yeah. I would say so. I think that most in Peterborough anyways, we have most of our family health organizations, regardless of what team you're, or like family health team you're with, there's a setup so that there is an after hours clinic, and they're set up, it is, I hate to say it, but sometimes it's physician dependent. They may say, yeah, no, that's something that you see their own family doctor tomorrow. I would say parents should push to be like, hold on a second, I can actually get in tomorrow, and I want to know what's happening for tomorrow. So I think you can be a little bit assertive in that, saying, you know what, really think this is something that should be assessed today, and if not, I'm gonna need to go to the emerge. Um, there is also, it's tough because we're always, Ryan, you and I are involved in educating healthcare providers, and it's a challenge depending on who you see. There's definitely going to be a different comfort level with diagnosis and return to play protocols and things like that. I'm lucky in that I've been involved with this quite some time, so I'm comfortable with all of this. And that being said, with a busy practice, I haven't read the newest guidelines in the last year, so I know where to find them. But I am comfortable with that. There's going to be emerge physicians. We all have to be big generalists, right? So I always we've talked about this regularly. Like, how do I encourage my colleagues to stay on top of the education, and take it seriously, while I also understand that they also need to stay on top of how do I put a chest tube in and take care of diabetes and all those other things. Um, but emerge physicians are, for the most part, very, very comfortable with this and are going to give good advice. And you go through a diagnosis. So diagnosis is also very tricky. It's not like you do a blood test yet. That's another thing, but, and we're not scanning everybody because for very good reason. Um, so having a comfort level with a clinical diagnosis can be challenging. I would, say that most people are gonna argue on the side of, "Hey, you probably have a concussion. This all your symptoms are in fitting with a concussion. So let's treat you as if you do, and we'll go along those lines." There's some, routine testing to do for them, and then some will follow the scat testing. That does take quite some time, so not everyone is going to go through that. That's often it's really set for on the field or on the rink at the time of an injury. And, so yeah, that's where, in my experience, the biggest thing with diagnosis is, if I had to say one thing, it's when someone just says, "I just don't feel right." And if that's super vague, I understand that. But often they'll come in and they'll say, "I can't really describe it." I it maybe some people describe it as the brain fog or whatever. They're like, "I feel a little bit nauseous. I have a little bit of a headache. I just something's just not right." And having been there as like before myself, I get it. And I'm like, "Yep, I understand what that feels like." Um, We're also scanning for the first thing that we have to do is make sure we're clearing all of the red flags, right? So that there's not a more significant injury, and that on your normal typical child, like slip and fall and routine, a little bump. We usually don't have to worry about the big red flags, but sometimes with some of the high impact sports, if there's vehicles involved or whatever, we do have to make sure that, cervical spine is fine, that there's not a thought that there's a bleed that we're missing, making sure that someone is stable. That's always going to be the first bit. Most of the time, that's not the case. So then you get into I have a headache. I don't feel right.
Yeah, so when you're going through your diagnosis, are you typically using the scat? Is there any other diagnostic tools that you're using? And then how does it progress from there?
So I do think this is more on clinical comfort levels. So there's a variety of different tools you can use for diagnosis. I'll be honest that a lot of that is going to be research based because physicians don't have time to spend half an hour, 20 minutes typically with a patient. So you go through your low lying fruit and if I think that if you can make it, I think you can make a diagnosis of a probable concussion quite quickly. Um, you know, Usually in the first few minutes, just with symptoms and the history of the injury or whatever, you can say, "Hey, this is probably a concussion." And that's the first part. That's on day 1, right? Because then you go, "Okay, now what?" Because the treatment of it and follow-up is really it's the important part is serial evaluations.
Yeah.
That's gonna be the biggest part of where are you going? Because everyone's very different in how they progress, how they heal, how they potentially get worse. Everyone is so different. And there is good research to show that some people are at higher risk than others. And, I'm just going to put a plug in right now for, the braininjuryguidelines.org is the living resource. So the living guidelines so that they're constantly changing as newer information comes out. Um, there are a lot of there's so many different research papers that have and studies that have gone off and look at different diagnostic tools. Everyone uses a different one, but I think physicians are going to get comfortable with their own, hey, how do I feel? Am I comfortable making a diagnosis just by having this conversation? And I would say that at most are.
Okay. Okay, so then when we put on the parents or through the parents' lens now,
Yeah.
what are some things that, like questions that you think that they should be asking as they're going through this first appointment, and what would they be expecting?
Yeah. So I think the first thing is if a diagnosis of concussion has been made, then the always is, "Okay, now what?" Right? So, how long do you think recovery is gonna be? What does recovery look like? And how do we help whoever, recover to their best ability, right? So, maybe we can talk like I've mentioned, everyone is gonna recover differently.
Yeah.
Um, and, I think the latest literature I've read is that for youth, really, we're looking at a 2-week. That's kind of an expected within after 2 weeks, if this is a first injury, mildish symptoms, even though that doesn't matter that much, to the degree of symptomatology for length. But, after average would be about 2 weeks, but I never tell people that.
Yeah.
I say, yes, it can be, but I have to be vague with because I really think it's true that we don't know. Okay. So we have to see you regularly, not necessarily a physician, but you need to be followed regularly so that you can see, hey, today was pretty good. In 2 days, I'm now able to do this. So that's the important piece is how do we progress through this? So my first message is typically, hey, you're gonna you're gonna feel tired. That's okay. Gone are the days of waking your child up in the night to make sure that they're okay. And that, in all honesty, at the time when they did that, it was basically to make sure that the injured person was still alive. That's where that came from years ago. But they're allowed to sleep. Brains they've been shaken up. They actually need some sleep. Um, but more importantly, they actually need some activity. So next day, I wouldn't say the day of, but next day, if they have mild headache and if they're just, I'm not feeling great, I do have some photophobia, the lights bother me, the sounds bother me, it's okay to still go for a light walk. I actually want you to go for a light walk because that's the only thing that's ever been shown to help with general concussion recovery. And I say general concussion recovery because we know that concussion has a variety of symptoms with it. And once we get into the prolonged phase, we don't treat general concussion. We now treat the specific aspects of what symptoms are bothering you. Is it MSK? Because like most of the headaches are going to be MSK based. Okay. Cervical spine, whatever. And especially later on. But I would argue that most of the headache component is going to be MSK based. But the brain fog's not. That's a true you need to let everything settle down. Um, so what has been shown to help with that is, you know, a 20-minute walk. And that's what I tell people to start with. 20-minute walk. If it's in the middle of the winter, if you have a spin bike or something, get on a bike for 15, 20 minutes and just go light. Okay? We just want you to move. The next day, if you're still feeling symptomatic, you can still do that again if it didn't get worse. You do it again, and maybe you add another one in the afternoon. And this is where I find there is the art of concussion treatment because and it's hard. I find this is the long discussion part with especially with parents and for with older students is that you're gonna really have to follow your own symptoms. So, if you're feeling a little bit better, then you can go on to your next step. And most return to play and return to school, and we've all talked about, the different protocols. You're on step 1, step 2, or stage 1, stage 2. You're now ready to go on to the next one. You don't have to be symptom free to go on to the next one. Okay, I think that's pretty important. If you're severely symptomatic, no, you're probably not going to feel like it. But once you're able to, like, hey, I don't feel great, but I'm okay, then you can move on to the next step. If your symptoms get worse, and I'd say quite a bit worse, then you have to go back. You weren't ready to do that. If they got mildly worse, that's okay. That's okay. You're not going to do more damage you're not going to likely prolong your symptoms. And I've read some great stuff about rating your symptoms on a score from like 1 to 10. And if someone says, my main symptoms are going to be headache and we'll say headache and fatigue. If I rate my headaches at a 3 out of 10 and I rate my fatigue at 3 out of 10, if the next day after doing some activity or increased stepped up activity, they go beyond an increase of a total of 2. So if the next day it's a 4 and a 4, that's okay. Okay. You can continue with that. You're allowed to stay at that level. If it went up by 3, then you actually should probably step back on that intensity. If you're less than that, you get to ramp it up. Okay. And I like that's a concrete way for people to measure, hey, where are we at? And parents can kind of, make a little chart. Excuse me. Where can we go with this? Where are you, how's your focus? And, focus, that's the brain fog is when we start talking about schooling, that's part of it as well. So that's how I would approach going into it. Now, there's also all the forms to be signed, right? And this is where, you know, the government's has it, and all the policies have that. It has to be a physician, a nurse practitioner to sign off on these return to play, um, and return to school activities. And but and because of the difficulty in getting in to see primary care, the now it's usually at step 1, and then step 5, I believe, is where, we sign off, "Okay, you're now ready to go back to full contact," or maybe even just into, um yeah, I guess full contact practice is what it would be before you go into a full match, return completely full symptom free. Um, but I like checking in with my patients. Like, I often will call them a few days later and just say, "Hey," and like, we'll book an appointment. I was like, "Hey, I just want to check in. I don't need to see you, but I just want to see where you're at. I can help guide. What's your next step? Where are you ready to go with this?" And I do divvy it up between athletics and academics, because I think those are it's going to be quite different.
Yeah, that makes a ton of sense. And yeah, I was actually going to ask you, like, how do you navigate the academic side? Say a student's getting back to academics fairly quickly, but they're struggling to reintegrate back into sport. What are the types of things that you would be recommending to parents in that scenario?
Well, one, I tell them that it's probably going to be like that. You'll likely recover differently on both the academics, cognitive component, we'll say, and your athletic piece on your symptoms. So expect that, and we treat them as two different things on the platform of returning to activity. So, you know, returning to activity, I would follow those symptom guidelines for exercise. Because, and again, I'm talking about recovery because we do want to push even kids who are non-athletic. I tell them like because right now we're assuming that these are athletes. It's often not athletes, right? It is that funny elbow at recess, um, or I hit my head on the drawer. So, I still encourage those kids, "Hey, you're gonna have to go for a walk." As a family, we're going out walking for 15 minutes, because that's what's gonna help you get better, and then you're gonna stay off your screens because that's gonna make you feel worse, and you're gonna go to bed at a reasonable time. So, and if they're 18, I say don't drink anything. But, um though I think those are the keys. With academics, it's a little bit again, it depends on what grade and where they're at with exams and tests, what part of the school year. This is where the art comes in. You have to it's all individual and case by case. What can you do? What is reasonable and without pushing. But I am one that pushes a little bit more, I'd say, than hold back. It's not just rest until you're it's never just rest until you're symptom free. I don't think that's realistic.
Yeah, that I think I agree with that too, like more of an active, gradual approach to recovery, right?
Yeah.
At what point would like people need to seek additional care for their concussions and what does that type of care look like?
Yeah. Yeah, that's a really good question. Um, so I love there's I think it's Parachute is the BC program, is developed by pediatric and sports medicine out at UBC. They have got a great website, and I actually, because I'm involved with soccer in town, that's often the site that I provide for our club saying, "Hey, every parent have instead of just signing off on, hey, I read Rowan's Law," which everyone doesn't read and they just tick off the box, "Yeah, I read it." There is a course that you have to actually have a certificate, and I encourage the families to go through it together. And at one point in it, there's a diagram. I'm obviously biased as a family physician and an emerge physician, but you know, the physician or primary care is the quarterback of that care. They're in the middle of that hub. And once we start getting certainly like past that 2 weeks piece, if things aren't continuing to steadily improve, then we have to go, okay, now what? And that's when we start doing more symptom based. Okay. So is it the emotional component? Is there, depression, anxiety? Is it a sleep component? And we tackle that independently. If it's headache and neck pain, but I would argue any headache, you know, massage, physio, and chiro are all very good resources for that. And all have been trained in that type of care. Um, because I would say that's where a lot of the headache component comes from. If we're talking about um, fatigue, then it's time to work up. Well, what else? And this is a super generalized thing, but that's a tough appointment because you're like, okay, fatigue could be anything. So now we start breaking it down. Well, let's go deeper into what possibly things could be causing fatigue. Do you have sleep apnea because you're sleeping deeper and you're snoring? There's all kinds of things, or you're not eating as well because you're not there, or there's all kinds of things. But and it does take a lot of work. So at that point, if after a couple weeks we're not seeing a progression that we would expect, then it's time to go, what symptom are we dealing with? And that's what we're trained to do, right? I have this problem. Great. What could be causing that problem? As opposed to just saying, oh, you have a concussion, right? And we start tackling them individual pieces.
So you mentioned the emotional and cognition side of recovery. Do you have any people that would work best with helping kids or people with
Yeah.
concussions for that?
So no, that's a good point. Like, I mean, when I talked about headache, I often will say, hey, please get involved. with chirophysio massage, with the psychological component, and kind of lumped into that, though they are separate, is the cognitive piece. You know, occupational therapists, psychologists are also very good at helping with those. And I know locally, like we have the acquired brain injuries group that has great resources, so that's a pretty good resource. But if we're now dealing with, hey, there's now manifestation of this child is now they're showing depression. We'll say, hey, a lot of their symptoms are concordant with a clinical depression. Then we start treating the depression. Are we not necessarily treating? Sometimes there's a role for meds, sometimes there's not. But going deeper into that, and that also includes allied healthcare on top of being followed by their primary care.
Okay, great. And so you mentioned this art form of like concussion
Yeah.
recovery in many ways. I like to think of that as almost the pacing element, right? Like it's a lot to do with pacing
Yep.
is that art. So you're feeling it out. So what are some things, especially as a parent who may be seeing their kids go to school one day, come back and just completely drained, like that battery's drained, the social battery, emotional, physical, whatever, is completely drained. How would you suggest they help their kids manage this as a parent?
Yeah, it's a good question. So first off, I don't want in that first appointment, though I try and be upfront with all of symptoms, I also don't want to fear monger, right? So I don't want to say, hey, you can expect that you are going to get really sad and feel isolated and you might not be able to do your homework for a week. So one is presented in a way that, in a kind and gentle way, that, hey, you have to be aware of some things to look out for. Not everyone's going to have this. Everyone goes very differently. Here's when I would like to see you back if you start presenting with some of these things. Most of the time, that doesn't happen, right? So I try and present it with a confidence first, like optimism. Things are probably going to go really, really well. Especially, and the studies about who are at a higher risk of having prolonged symptoms, like there's very good research for that. And so, younger girls are higher up there. So I want to present that as to them as a much more optimistic way. Um, but what if a parent said, "Hey, they're really struggling," I say, "Hey, I always say, "You have to watch for this." Um, if it happens, please come on back, or if it's not me, say, because often it'll be me as an after hours. Go to your own family physician. I will be sending them a note saying, "This is what we've seen, and here's what I'm hoping," and I'll write them, "Can you please follow up with so and so in 5 days?" Just to check in. And if I write them a note, very few family docs are gonna be like, "Yeah, forget it. I'm not doing that." That's why I write a note. Please see this person just as a quick check in or talk to them on the phone. And I do tell the parents, like, take it easy for a couple days. Don't set your child up for failure. If they have an exam the next day, I'm more than happy to write a note saying, no, this person should not write. That's not fair. They're not going to feel up to it. And, you know, sure, are some people gonna malinger, and malingers, kind of exaggerate their symptoms for secondary gain? I don't care. Some might, but it doesn't matter. We still have to treat the patient as if they're what we're seeing. And but if it's a normal routine, like say it's late September, school's just getting going, and I'll say, you know what, it'll be reasonable for you to not. I would like you to go to work or go to school like you can. Maybe go in for their morning class, or I'll ask, what is the more important classes here? If you have gym, that's probably a reasonable one to sit out. Uh, you're going to be working on something important in science, and go to that class, sit there and let your teacher know. So that's another part. I guess that's a good point. Is like informing whoever it is, and it's different at every school. You and I've talked about that before too. Sometimes it's a vice principal, sometimes there's a teacher consultant or a liaison or whatever. But everyone should. I think transparency is key, and saying this is where we're at, this is what we're hoping for. You know, please, if we can have a little bit of grace for a couple days, they're not likely going to be able to do a whole lot of reading is tough. Reading fine print or for sure on a computer screen, you know, that makes everyone feel real bad if you have an acute injury. Um, so it's not fair to expect that. And then and you say, "Holy, I don't expect you to be able to do these things for the next couple days. I would still like you to be involved." And I think it is reasonable. I also do tell kids like your first couple days, it might be that you just stay home and listen to music. Don't just lock yourself up in your room in a dark room. But you might not feel like doing a whole lot. That's okay. After a couple days, you should feel ready to start going to class for a little bit, maybe doing some reading. You might be full-fledged ready to go. That is also a very realistic pathway, but you might not. So maybe for that week, you're only doing half your work or half your classes, and then you will slowly build up to what you can do.
Yeah. Yeah, I think that gradual return is very important, right? But also getting in there after they've maybe had a day or 2 to rest is super important, right? Where
Yep.
you get back into the environment in an adapted fashion, and the kids are just back, and I know when I was going through my concussions, like, 2 weeks, you're off school, you're in a dark room, in that bedroom jail type of thing, and
Yeah.
obviously this was several years ago, but it's went come a long way since then, and I think, that sort of thing is very important, and obviously, the parents would have to then connect with the teachers, as you mentioned, and then would that be the same for the sport environment too? They'd be getting involved with their coaches,
Yeah.
say if they're not, if they didn't get injured in sport even.
My experience in all reality is that coaches are taking this much more seriously. Um, Now maybe it's because people know what I do and who I am, and I see it there, they act differently around me, but for the most part, like, I get a lot of formed and they're like, "My coach will not let me do this until I am signed off," and I applaud them for that, right? Like, good. I'm glad that you're following this policy very strictly. Is it a little too strict? I probably would be lenient, but again, I have the experience to be like, "Yeah, you know what? You're now ready to do this." Um these are guidelines. That's another important thing. These are guidelines. There's not a strict rule. Here's how we suggest for most people. If someone has more experience with it, it's okay to go off those a little bit. And I certainly have with certain things. Like, hey, I know you're having this symptom, but I really don't feel that this is necessarily related so much to the concussion injury. I think you're ready to actually push yourself a little bit more. But transparency with coaches and with the schools is very important so that there is constant dialogue as to what we're going. And what is a little bit tougher too is like the age of like the student. How much is our parents getting involved? And this day and age, we're always talking about the helicopter parents, and it's hard. Like at 17, I hope that the school system trusts this 17-year-old student to make to be responsible for those things. They shouldn't need a parent to like to say, "Oh yeah, if they're ready to do this or not." And also don't want the parents constantly going into the school to say, "Well, no, 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 no." Like I would put a little bit more emphasis on the older mature students to be able to speak for themselves. It is a little bit harder too when they're not feeling well. In the acute phase, they may not be able to do that, but later on, as they're through progression, I think that is part of the return process of like being independent.
Yeah, there's a certain advocacy component that comes with it, right? A
Yep.
self-advocacy or the parent, right? Say they aren't getting the support that they need in certain areas. Of course, they're going to want to advocate in as much as possible. But I totally get what you mean of striking that balance there. So when it comes to return to sport in particular, what are some I know we've kind of touched upon it, so maybe don't cover too much of it, but like when is it safe for them to fully return? Like if you're to define that.
So, we'll call that being cleared. Okay, you're cleared of all your symptoms, right? Um, for most athletics, so if we're talking about contact sports, and they're not always just contact sports, but so when if you're playing a sport and you're involved in a sport that puts you at risk of um, being hit, falling aggressively to the ground, like maybe it's long jump, maybe it's pole vaulting. Um, that's a little bit harder because the return to play, and you look at the steps, they have to have, you know, first you go back to, well, we can start from the beginning. If I'm feeling quite a bit better, I'm able to ride a bike. I'm able to then jog around a pitch, and I'll use soccer because that's what I'm most comfortable with. But like, I'm able to run around a pitch. Um, I actually want them to do some foot drills, okay? Because then there's that cognitive loading piece as well, which can certainly make symptoms a little bit worse. I don't want them involved in any practice or any actual drills, but I want them with their teammates in their warm up, doing a warm up and passing that ball around and playing with the ball on their feet, because it's normalizing it a little bit, and that is the next step. If that goes well, and the next day they haven't jumped up by those 2 points, then I say, "Hey, you can actually get into formal drills with your team." Okay? As long as they're not drills that's putting you at risk. So you're wearing a non-contact penny, and I am running a passing drill. I might be hitting the ball. I might be doing whatever. If that goes well, then the next day you can play in a non-contact scrimmage. You're still wearing your penny, but you're playing in a scrimmage. And this is where it's funny because you have to actually ask some of my times the coaches. I'm like, if you want them to play on Saturday, I need you on Thursday or Wednesday to run a scrimmage. Like they have to be involved. And this is where the art piece is because sometimes that's not possible. So it's all in my mind, I'm like, okay, I understand what drill you're running, that what you're going to be doing that day. That's probably equivalent to a non-contact scrimmage. If that goes well, then you go into within your own team a contact scrimmage. And then if that goes well, that's when you're cleared. I've played in a non-contact scrimmage in um, a somewhat controlled space with my own teammates. I'm no longer wearing the caution penny. I am now cleared if you're non-symptomatic the next day. Does that
And
make
of
sense?
course, yeah, yeah, I think so. So I think the one thing there though is based off the protocols, right? You would need that approval though from a doctor of sorts, right? Before they get
So
into
that's
that.
that's the thing. If you've got, and it's hard. I run into this many times. Hey, I have a tournament on Friday, and I need to be seen and signed off on tournaments on Saturday. I need to be have signed off on Friday. Like there's a lot of physicians that don't work Friday afternoons, right? Um, so that has to be kind of planned out a little bit, or you make an organization. I do work Fridays, so that's good. But for like people who've done, like, is it a nurse practitioner that can sign off, or maybe one of their colleagues? And I've done that before too. If I'm going away, like, hey, I find out who's on call that day. I'm like, hey, can you just check in with this person to make sure and sign off so that they can play the next day? Um, Again, it's being signed off, and this is a formality, and these are guidelines. If there's not, if there's not an we don't have to send you to the merge to get signed off on it. All right. And I'm hoping that a lot of teams are and organizations are realistic in that way, and that I'll even contact them or have the parents say, hey, I'm quite comfortable with you returning to that game. If you follow these protocols, I'm going to trust you that it goes well. I'm okay if they play in the tournament on Friday or on Saturday. I've done that. Okay. Uh, is it perfect? No, but I think it's realistic, and I think it's very reasonable.
Hmm. Yeah, there is obviously some concerns where it's a little bit, the protocols anyways are a little bit too rigid in their structure, right? So I
Yeah.
think you're hitting on that a little bit, right?
Yeah.
Yeah, okay. Well, so I guess the last part that I would say, just because it is a part of the process for some, not all, but some, could you speak a little bit to what the care looks like after somebody may be experiencing prolonged symptoms, and just like how that progression looks a little bit different? We've talked a lot about maybe more of the ideal pathway, but what about that non-linear, longer pathway for people and what that looks like from a parent's perspective and maybe some things to help with that?
Yeah, I think most of us have had experience with patients, clients who have not followed our expected pathway to recovery. Obviously, that's a little more challenging, and I'll just bring it back to what I mentioned earlier. That's when you start bringing it up to symptom based, and you start relying on. Uh, I would rely on, as a family physician, the expertise of others to start following and like helping with whatever aspect that I'm not quite sure what to do. I'll say it will not involve typically a pediatrician. It will not involve typically a neurologist. Um, there's a few cases with neurology, but very seldom. Neurologists do not want to get involved with this for the most part. And that's the other thing that this is a especially with the prolonged cases, these are very challenging patients, very, very challenging. And they're at a loss. They feel stuck. As a family physician, I feel stuck. I'm not sure what the next steps are, and they're saying, "Well, what's next? How do we do this?" And that's where it's also very challenging to have that conversation of, "Well, we're not sure, right? All we can do is try and move forward." Um, and it's gonna be chipping away slowly at each of the type of areas where you're having issues or deficits. From a medical standpoint, physiatry, there are a few physiatrists that have a bit of an interest in this, but even that, that's based out of Toronto. Those are a lot of the people I work with the University Health Network, like the UHN Echo program. So there's a couple neurologists, physiatrists, um, from medicine standpoint, sports med docs, who are also involved in that. But the reason we have the Echo is to help teach mostly primary care, but we've had chiropractors, physiotherapists, psychologists also come and join on to help guide some of that progression, because there's very few concussion clinics. It's really not a thing. There was one in Barrie that's actually not happening anymore. Um, and the specialist would say we actually don't really need to have this because there's not a whole lot I'm going to be able to offer. So a neurologist would be involved. There are neurologists that are involved when headaches aren't going away because they're headache specialists. So that would be a reasonable referral. I would say I'd write a referral note and say, and again, it would be for us, it's outside of Peterborough because our neurologist won't see patients really as referred from outside the hospital. Um, but it's prolonged headache or headache persistent after having, a year after having a significant concussion, um, hoping for some advice on how to help with this, like diagnosis. So now it's clarity of what kind of headache is this? And once we know what it is, how do we start tackling that?
Okay. Yeah, thank you for sharing. So I think that's probably it for all of our like main part of the webinar, but I do want to open it up just one last time to you, Steph. If you have any key takeaways that you want people to take from this, like just in general for a parent out there who's maybe navigating this?
What would my message be? I, I think is one is presenting it with optimism that, concussions happen and most people recover well. Okay. But then be aware of like some of the more worrisome things that, if things aren't recovering, then we follow up and we start chasing after those. But if you follow the guidelines, or if we follow the return to academics, return to play that we've discussed, most times things resolve. They'll have a head injury and they will never have a head injury again. And I think it's reasonable to go ahead and say that. And I think that when someone comes into it without fear of, oh, I'm going to have another one and I'm never going to play hockey again, you know, I think that puts them in a bad place. I think you're already a step back towards recovery. So I really try and stay away from making people fear this, but being realistic of, here's what we need to watch though.
Okay, awesome. Thank you, Steph. So that concludes our webinar, The Parents Playbook for Concussions. Thank you so much, Dr. Steph Dalliare, for all of your insights on the topic. We will open it up to questions now. If you want to submit any questions in the chat. Okay, we have one here already from Jennifer Madden. Oh yes. Actually, we were meaning to talk about that. So what are your thoughts on concussion baseline testing? Yeah, you could probably see it in there.
Yeah, I'm just reading it now. So I'm not sure if there's much conflicted literature, to tell you the truth. I think it's the evidence is pretty clear that baseline testing is not recommended for most athletes. I know the OHL does do it, but I also know that my Pete's players sandbag, so they were like are quite open about it. I'm like, okay, great. So if good randomized control studies and hard like good evidence based research would suggest that there's actually not really much of a role um for baseline testing.
All right. Well, if there's no more questions, um, we appreciate everyone's time here. We are really excited about this new webinar series. We hope that you will all join our next one on October 21st. And we would like to again thank Dr. Steph Dalliare for joining us today and sharing all of his insights. And we appreciate everyone's time, and hopefully everybody has a great rest of your day. All right. Thank
Thanks
you.
for having me.
Yep. Thanks, Steph.